Howdy folks, Dr. Ed here with Total Body Healthcare, and I've got your Whiteboard Wednesday thought of the week. As promised, last week we talked about we're starting a little bit of a look into pediatric chiropractic care, so we're going to continue that. We're going to dive in deeper into this concept we introduced last week of bottom-up, back-forward development of the nervous system. And introduce you to kind of a nerdy chiropractic word. It's big in the research right now. It's something that we call neuroplasticity. Basically summed up, neuroplasticity says that your nervous system has the ability to relearn habits. And we all kind of knew this. We just didn't know how deep it was in the brain. We can learn to do new things. The neuroplasticity part of our nervous system does slow down a little bit as we age, particularly if we don't use it. I'm sure you've seen those studies that talk about learning, continuing to do crossword puzzles and that kind of stuff as we age in life that keeps our brain healthy. That's neuroplasticity is what that is. So how does that develop throughout life? Well, it first starts with us as infants. You know, we mark them with pediatric milestones, if you will. You know, is the infant learning to hold its head up? Can it sit up on its own and engage those core muscles? Did it learn to cross crawl? Speech development. All of those milestones that we talk about with infants is evidence of neuroplasticity of the brain and the nervous system learning those habits. A lot of them do take place naturally. They're kind of built into us, but we still have to learn how to use them. But where the problem comes in is when a trauma is introduced into that nervous system, then the neuroplasticity it kind of gets, the course begins to get changed, if you will. And those abnormal, from the trauma, the nerves begin to fire abnormally and it sets it off on a different course. We see it in real life as symptoms, if you will, with pediatric stuff. We see digestive issues. Maybe sinus allergies kind of deal, emotional issues with little kids, outbursts of anger and that kind of stuff. That's a sign that their nervous system is not working like it should be. It's abnormally functioning because of the trauma that was introduced. In adults, I can't tell you how many times patients have come in here and say, Doc, you know, it's been bothering me for 6, 8, 10 months. I've even had a patient tell me that the symptoms that brought them into my office has been bothering them for 10 years. Well, here's where that concept of neuroplasticity really kind of, the rubber meets the road, is I want you to think about it. Nerves that fire together, wire together. So in other words, if you're developing normally, once you get set off that course, those nerves begin to develop that way, and therefore the longer that it's in there, the longer that it takes to get it unwound and back on the right course. So my encouragement to you for today, for this Whiteboard Wednesday, have your nervous system checked often, regularly. And your children's nervous system as well. Remember, a lot of times we don't necessarily know where that trauma was because it isn't necessarily a physical trauma. It can be chemical or emotional as well. We don't necessarily feel those things when they happen to us like we would a car accident or falling down the steps or something like that. So hopefully that helps you understand the bottom-up, back-forward development of the nervous system. Really think about that phrase right there, nerves that fire together, wire together. I'm Dr. Ed with Total Body Healthcare. There's your Whiteboard Wednesday thought of the week.